It really is great to see the amount of people that are interested in hearing from Alex McTier today. It's a really interesting piece of work that he's been involved in, so I don't want to spend too much time you listening to me, but it's going to be a really good hour as beginning to think about what Alex and Ruth have been able to think through and uncover as part of that, looking at the data around what's been happening for children, what some of the needs of children might be, and where some of the hidden harm might be identified. Alex will work through what they've discovered and also be able to make some comment around some of the analysis that they've done around that and some thinking for the future as well before we're finished. Alex will work through a set of slides. If you can, stay muted, which would be great, and during this presentation. And if you've got questions as you go, put them in the chat, and I'm going to try and catch them as we go forward so that I can gather some of the questions up at the end and give them back to Alex to encourage a bit of conversation. If there's a question that I think, oh, I need to know a wee bit more about that, I might come back to you and ask you to say a bit more about your question. I might not, but just watch out for that. And it's just tell me a bit more about what you want to understand more about. As usual, a bit of housekeeping when we're on this type of thing. Alex's presentation is going to be recorded, but the conversation afterwards won't be. And we hope to send out a bit of a rough and ready copy of the filming of Alex's presentation for you. But the questions in the conversation afterwards won't be. So please feel free to put your curiosities into the chat function, and we'll see where it takes us by the end. Really nothing else from me. I don't think. We want to hand over to Alex and have him do his presentation, and we'll hopefully be done by about 1. I know that folk have made a commitment to be here, so we don't want to take up more of your time. Is that okay?
Thank you, Lorraine. Well, hello everyone. Good afternoon. My name's Alex McTier from CELCIS, and I'll be, just before I put up my slides, I think it's important to acknowledge that it's a beautiful sunny day in Scotland today, and I'm truly humbled that you want to spend that hour with me in the height of the midday sun and talking about child protection data. But it's great to have so many people attending today. I'm going to put up my slides in just a sec, but I think what I want to do is, first of all, just orientate you around a couple of key items that I think is important to set this work in context. So firstly, the presentation will focus on vulnerable children and the impact on them of the COVID-19 pandemic on them, and looking at the instances or risks of hidden harm. But I think what's important to point out is that right from the beginning of the COVID-19 pandemic in Scotland, there were 2 important developments that have continued all the way through 16 months on and 18 months on, and probably going forward. So those 2 developments is straight away the Scottish Government convened what was called a Children and Families Collective Leadership Group, which brought together a number of the key national and local stakeholders together, meeting on a weekly basis at quite a high level to review what the emerging evidence was around children and young people, and to provide some direction on what action or response would be needed to support vulnerable children and families. So we've had this strategic grouping, and this piece of work falls out of that strategic grouping. So we've got key people meeting together, but equally, alongside that, they quickly implemented a weekly data collection that primarily came from Scotland's local authorities, but was also inputted by Police Scotland, around a set of, I forget the exact number, but 15 or so weekly indicators that attended to different parts of the child protection and the children's hearing system. So we were through Scottish Government, working with SOLIS, which is a local authority representative body, they put that list of indicators together, and local authorities, it may have been a bit of a bane of their lives, but it has become business as usual, and that data continues to be reported to Scottish governments. And so that collective leadership group is getting that data. Now, this this research that's been prepared for that leadership group really builds on that data collection and trying to get underneath some of the emerging disconnect or uncertainties that weekly data has thrown up. So as I now put up the presentation, I think just bear that in mind. That's important context, and hopefully that helps explain some of the work that's been undertaken. My presentation will probably last 25-30 minutes and then allow time for question and answers afterwards. And as Lorraine said, if you could put any burning questions in the chat box, we'll come back to that at the end, but also please do hold on to any questions you have, and we'll aim to answer those at that point. So let's do some share screen. Which I proved it wrong. Okay, so acknowledging here that I'm presenting today, but Ruth Sills, who's the Protecting Children team lead at CELCIS, equally involved in this research. And while it has been quite a data strong piece of work, and that in the report, and the report is due to be shared or published on the CELCIS website likely next week, and so you can read that in more depth. And while that report has lots of charts and tables, you'll be pleased to hear that I've only got one chart in this presentation. But it's an important chart because this sets the context to the work. Now I'm going to use my arrow to help talk you through this, so I hope you can see my arrow cursor to help here. So I mentioned earlier that we have this weekly data collection provided by local authorities, and it provides indicators, measures around different parts of the child protection and children's hearing system. Now I've cherry-picked 3 here on this chart, but it shows where the perhaps concern or disconnect in the data was, which the leadership group at the Scottish Government level wanted to investigate further. So in the white line, hopefully you can see that is the number of weekly child protection concerns being reported by Police Scotland, and the grey line, so that's very early stage child protection, that initial bubbling up of concerns. And then those typically fall through to where there is a level of need or risk identified to an interagency referral discussion, an IRD, where education, health, social work, police will come together and have a conversation around what is that level of need and decide whether that child's concerns require further investigation and perhaps lead on to a child protection case conference, and then henceforth potentially registration or going down the children's hearing route. So these are earlier, for me, these 2 indicators are earlier stage activities with regard to risks and concerns. And particularly over the autumn, or from summer up to autumn, both these lines, although they're going up and down, the general trend is one of increase. We then have a dip around the Christmas holidays, and then we see a return to that increase afterwards. But really it's this period around the autumn which is of most interest, because we're seeing that general trend of increase at that earlier stage. But that, when we look at that latest stage activity, as in the number of children then becoming registered on a child protection register, and albeit there's often inevitably a time lag of a 3 to 4 week delay from that initial concern through to going through the conference processes, etc. Notwithstanding that, we weren't seeing a corresponding increase in the number of registrations. Indeed, we're perhaps seeing a slight decline in registrations, and we were seeing a similar decline in the number of children becoming looked after. So what the leadership group really wanted to understand is what is happening here? Why are we seeing this disconnect? And are there concerns around some hidden harm where children aren't being seen and their needs being attended to? So that's the real context to the deeper dive. So in terms of our research, we recognized using the data, we could only take the analysis so far. We had to do more of a qualitative insight and work with local authority areas, selected local authority areas, to to really investigate what's been happening in their local area and see if we can derive that local intelligence to provide national understanding. So through a subgroup of the collective leadership group, so we had members of Scottish Government, Care Inspectorate, Social Work Scotland, and local authorities were on that. We identified 7 local authority areas that provided us with a mix of urban, rural, north, south, island, small local authorities, large local authorities. But also we were looking for those that we were fairly confident could provide us a good sense of their data and their data story. And
but I think this is just a bit, it's similar to the first point about notifications around how and who the different teams notify around the reports.
Sorry, I can't see who's coming in there. Is it okay if we come back to questions and reflections at the end? So, so we work with 7 local authority areas. We that involved having conversations with their chief social work officer, their data officers, other social work managers, and drawing on their additional local data to really pose and answer these questions around to what extent has local demand changed since the pandemic, any distinctive trends, particularly thinking around different age groups of children or more vulnerable groups of children, perhaps children with disabilities, if they've encountered any instances of hidden harm, and if so, where they might exist, and then thinking about what might be the asks or priority areas for consideration. So at the end of this presentation, we'll bring together some of the key recommendations or questions that the local authorities wanted to pose to national government and national partners. So coming to the first bit around the concerns reported and thinking about that earlier stage activity and trying to explain that. But the local areas, 7 local areas we spoke to, they certainly recognized that trend of seeing an increasing number of concerns and an increasing number of interagency referral discussions. But, and in doing so, they also recognized that a number of these concerns were more complex. There were more things going on in the children or the families' lives. And because of that, because of those concerns being increasingly complex, they did merit not just going to an interagency referral discussion, but then also going into investigations. So although there wasn't an indicator at this stage around the number of investigations happening on a weekly basis, if we had collected that data, I think it's fair to say the number of investigations at a national level would also have been increasing. And to explain that, they felt that increasing concerns or increasing risks and complexity and types of those concerns were really a result of the pandemic having a significant and very abrupt impact on the early intervention or preventative services. So the ability of home visits, particularly around or third sector work with families, really came to an abrupt stop. And also other avenues for where a concern might arise and you wanted to discuss it with a colleague, perhaps on a more informal basis, were less available. We didn't have team meetings where you could come together and say, this child has presented this, or this mother's made me aware of this. What's your view on this? So because you weren't having that informal conversation and check-in with colleagues, the most appropriate basis was to actually escalate it to more formal processes. So you're more likely to process it up to an interagency referral discussion, and then of course onto investigations. So there's a number of factors why we were seeing the increase in early stage of activity. In terms of the specific concerns raised, these didn't differ from pre-pandemic times. We're still seeing the predominance of child or young person's mental health, parental factors such as their own mental health, domestic abuse, increased parental alcohol and substance use. So we're seeing that increase in neglect and emotional abuse. We're seeing these are common concerns that we see on an annual basis through the national statistics, but they did appear to become more acute. And I'm going to have a more detailed focus on mental health, I think, in a couple of slides. So that was what was coming from the local authorities. So they recognised the national picture, and we also took this opportunity to engage with some third sector organisations, particularly their research and reports that they provided and published during the course of the pandemic. And we're seeing very much the same types of messages around mental health, anxiety and isolation amongst children and young people. And on occasion, that escalating in terms of eating disorders, suicidal thoughts, self-harm. So really seeing that escalation from those early bubbles or early concerns into more serious issues. Again, the parental concerns coming through, but also parental flagging into family pressures when they were starting to pick up issues related to poverty, job security, perhaps more accurately, job insecurity caused by the pandemic, and also issues of accessing welfare payments. So the family pressures increasing due to financial uncertainty, pressures impacted around the pandemic. And then the combination of financial pressures and also just families living together and spending more time together, perhaps not in perhaps maybe unsuitable or more cramped housing, then we're seeing more strained family relationships. So you're seeing those tensions bubble up. So those are perhaps quite cross-cutting issues that you could see across the country, and then local areas also, through our conversations with them, did notice, identify some other more distinct issues around for isolation for children and families with disabilities, and whether it's to do with the shielding of one or more in that household, so that having an issue around connection and engagement with services. Similarly, for the 7 areas we spoke to, in some of those, connections with some of the more ethnic communities were in case more stretched or more tense, and that could be due to media coverage of COVID restrictions being seen to be broken, whether in reality they were broken, but that again putting tensions on certain communities within the local area. And then perhaps haven't highlighted this enough throughout in this session, but local areas are really reporting the more fractured or difficult transitions faced by care leavers. So those leaving care, particularly those who are perhaps looking to enter jobs or go to university or colleges, really their arrangements, their support arrangements where they were living really struggled due to the COVID and the restrictions around where they could live and who they could connect in with. I said I would have more of a focus on mental health. So in the reports that we'll publish next week, we've had this as a key sort of case study box, but just lifting some of those messages up. And sorry, the text is a bit smaller here, but the context is that we are seeing over a number of years, we're seeing an increase in mental health concerns amongst children and young people. So that's a long-term trend and it predates the pandemic. However, the data suggests, and we've got a number of studies mentioned here and sources of data, that the pandemic has heightened concerns. And what we've got here is some evidence around this around different age groups. So firstly, around young people, the Scottish Government have funded what's called the COVID-19 Early Years Resilience and Impact Survey, so CELCIS, and that's taken different phases or waves every 3, maybe 6 months, doing survey of a good cohort of young people and their parents to understand what's been happening. And through that, we've seen their sleeping, their concentration, eating, behavior, and emotions all affected by COVID, whether directly or indirectly. So again, it's just showing that disruption that COVID has had is not purely among the louder, well, very young infants are loud when it comes to not sleeping, but it's not amongst just the older cohort of children, it's amongst all children, and including the very young children. In terms of the referrals to children and adult mental health services, so CAMHS referrals, we've seen that increase across all groups during the pandemic. Again, it's been increasing over time, but the greatest increases have been amongst girls. It's been amongst 13 to 16-year-olds, so adolescents, And also it's been amongst children living in Scotland's most deprived neighbourhoods, as measured by the Scottish Index of Multiple Deprivation. So again, we're seeing it really impact across all groupings, but more prominent in certain age groups. And then thinking about young people, and this was research I became aware of through a previous seminar. One of these previous seminars was around research done by the Mental Health Foundation into the impacts of the COVID pandemic on all adult age groups. They found that across all the different adult age groups, sense of loneliness and hopelessness had got most worse or most prevalent among 18 to 24-year-olds. So again, we're seeing that impact amongst young people coming through. And it's very hard to give cause and effect, but one could surmise that looking at death notifications among 15 to 24-year-olds, we've seen an increase in 2020 compared to previous years. So in 2020, there were 303 deaths amongst this age group, compared to an average for the previous 4 years of 258 deaths. So I'm not saying there's definite cause and effect there, but I think some of the impact of the mental health and how that can escalate to more serious concerns around eating and behavioural aspects could have contributed to that. So trying to wrap up, provide a bit of a model or a hypothesis around what's been happening in terms of explaining that initial chart. So taking it stage by stage, concerns and interagency referral discussions have increased. Due to their complexity, we're seeing more of those go into investigation, and so those two have increased. But while we've seen the numbers increase and complexity there, through investigation, local authorities reported that many of these concerns do not meet that threshold of placing the child at significant risk of harm or abuse, which is that threshold for then progressing to child protection case conference, and then where applicable, and the risk remains, onto the child protection register. So because we've not seen that percentage of children with that high significant risk or that threshold being met, then we've seen more children actually diverted into other supports. So whether it's single or multi-agency, getting it right for every child processes. So that is why that helps to explain that disconnect by earlier stage activity increasing, but the number of children on the register or becoming looked after, going down the children's hearing route, not increasing to the same extent. Another way of thinking about this is this triangle of children's needs, which I'm sure will be familiar to many of you. And this breaks out the child population and tries to conceptualize it in terms of their different levels of risks and the amount of support they need to meet those needs. So at the top end of the triangle, we have the children with the most acute needs, and statistically we would count those quite an arbitrary way of those on the child protection registrations with children who become looked after, plus high social work involvement. Now, the indicators through the weekly returns by local authorities suggest that number has been falling, and arguably compared to other years or previous years, now appears artificially low. However, that group in the middle tier, where they do have needs, they're perhaps not meeting that top high level thresholds, but they do have needs, complex needs relating to themselves or their family or their family situation. That has been increasing, but equally on the bottom tier, the universal tier that's typically met, their needs are typically met through health visiting or schools, those universal services. We're seeing more of those children having needs that are seeing them bubble up into that middle tier. Now, this is a hypothesis, but I think we've tested it in various settings, and people find some comfort in this, that this does explain where we're at the moment, that we now have more children in that middle tier who do have needs. The challenge is that statistically, it's hard to quantify that number of children in the middle tier. We have a measure around children with multi-agency plans that is part of the weekly return by local authorities. But I think it's fair to say of all the indicators, that's been the most challenging to record, and there's a lot of diversity in how that has been interpreted. So whether it's multi-agency plans or team around the child meetings, we don't have that measure that provides us with real confidence around how big or small that group is, or indeed how it's increasing or has increased during the pandemic. But the evidence across what we've put together through the wider report and through what local authorities have reported back to us suggests that it's that group that has been increasing most. So linked to that, we then had the question from the collective leadership group around hidden harm. So to what extent are there examples, instances of that? Now, through talking to local areas, they were satisfied that from a social work perspective and a health perspective, that the children that are already known to them, they are confident that their needs are being met. Now, a couple of reasons to highlight there for why. Well, firstly, as part of the weekly data return, there were measures around the levels of professional contact with those children, with those most vulnerable children. So that provided a real spotlight on those children and ensured that where contact wasn't being met or being achieved, that was quickly being reacted upon and addressed. But also local authorities also recognized some of the trends earlier identified and have been doing audits of their own local processes and decision making to ensure that cases weren't being missed, so that children who hadn't quite met that threshold, that was the right decision to be made and that the GERFEC processes were most applicable. So you can see the quality assurance aspect coming in there in terms of ensuring a tight response has been achieved. However, there were concerns around what I've labeled here as new families. So new families, as in they were unknown to particularly social work services. So the question is, for social work services, who are they? Are these families likely to reach out to us? And indeed, if they did reach out to us or they did become known to us, to what extent do we have the time and resource to really fully assess that family or that child's strengths and needs? Because that would be an assessment I could be right from scratch, and that takes time to build that rapport and understanding with the family. So within those new families, where the concerns around hidden harm may lie, or most likely to lie, is around particularly new parents, because they're quite isolated with their limited access to family supports or other peer supports or other parent or toddler groups. And albeit quite small levels, we are seeing a slight increases in unborn child registrations in the statistics. So that sort of bears out with that early stage young family synopsis there. Also, families struggling financially, and we could be on a bit of a tip of the iceberg here. It could get worse. So they may be currently supported or hidden from need in terms of further employment schemes, or there've been a number of direct family payment initiatives, whether it's through local authorities or third sector organizations, to support and address the financial impact of COVID. But those supports could unravel over time. And so we could see the number of families struggling financially and then impacting on concerns and tensions within the family increasing in time. And also, and this again, longer term around the families that have been shielding. So may have deliberately and intentionally not sought to engage with wider services, but to what extent will they feel confident re-engaging with services and with society and the economy more widely? And other specific hidden harm groups are less data here, but young carers. So the number of, this is Action for Children are funded to provide support to young carers. And they noted a drop in referrals in the previous year, and a quite sizable drop percentage-wise. So again, question, which seems at odds when we have increased shielding and ill health across the country as relating to the pandemic. So is that a vulnerable group a group who are in need of support, but just for whatever reason not accessing that support? bereavement, and this has short-term and long-term and unknown consequences, but I think it was the CELCIS study that I referred to earlier again found that 21% of children have experienced the death of a close family or member or friends, not necessarily COVID related, but for any reason since the start of the pandemic. So that's 1 in 5 children in just that year. So that is a high number, and so the impact is highly individualized and can flare out or be triggered at any stage. So really highlights the importance of having that trauma-informed, trauma-responsive and trauma-aware workforce who can, throughout the workforce, not just social work, who can really identify and respond in a sensitive manner to when these cases arise. And then finally, and we have very limited data around child sexual exploitation. There is some data provided by Police Scotland that's reported around convictions, but that seems really very high level. But really the extent of child sexual exploitation, or whether that's increased during the pandemic when so much more activity is being undertaken throughout our daily lives online. So looking ahead, and I put these conclusions together a couple of months ago, so please bear with me with the last one, that we are now in July 2021, but local authorities, when we had these conversations around Easter time, we're predicting an upturn in demand and early stage activity through to around the start of the summer holidays, school summer holidays, because we were seeing an opening up. So schools were returning, face-to-face visits could resume and become more numerous. And also just the opening up of households, and that grandparents, for example, could go and see their grandchildren, and they may then see or be surprised or really truly horrified by the levels of neglect or poverty that they had been unaware of through just phone contact or virtual contact. So they're expecting a predicted upturn, and looking at the data, because that weekly data continues to be provided by local authorities, that in reality was the case. We did continue to see an upturn right up to July, and then as typically happens during the school holidays, we've seen that dip away, but probably with the resumption of the school terms, that demand will likely increase again. And then in terms of those concerns, likely to remain unchanged from what I previously mentioned, and some awareness that the demand may endure for some years to come, and not just in the short term. However, because local authorities have been forced, I would say local authorities, but community planning partnerships and local partners have been forced to come together, work creatively and collaboratively and responsibly to the levels of demand, and going above and beyond in many cases, that relationships between partners have never been so strong, and that places the partnership as a whole is in a better position to respond to future need. However, they did also want to flag up that budgets around funding and also recruitment and retention could prove challenging in terms of responding to that future need. So a couple more slides. So just in terms of the asks of national partners, so with the preface that this has mainly come from our conversations with social work managers and data colleagues within social work teams and departments, that the big messages were that they recognize, particularly thinking about that middle tier of children in that triangle, how important GIRFEC is, getting it right for every child. In a sense, and from a policy perspective, it perhaps waned before the pandemic, but I think it's really shone a spotlight on GIRFEC and how important it is, particularly the aspects of, say, the named person role, someone who can really help identify and coordinate that response to individual children, making sure that we have real preventative spend in place and that it's truly aligned around children and families. And also that we have high quality child's plans. So child's plans that really do have detailed, smart outcomes that are truly actionable and will make a difference for children and families. And not just that we invest that time in developing that child's plans and making it look as great as possible, but also ensuring that they're truly followed up and they're truly implemented, and seeing that improvement in children and families' well-being and lives, and that risk decreasing over time. I've highlighted above around the preventative spend and making sure that there is increased funding for that preventative family-centred support, and that links in with the promise. And the third sector has a key role to play, and that links into the third point around making sure there truly is a conducive funding and operating environment for the third sector. That's longer term funding, supports collaboration, rather than that sort of more short-term competitive landscape that's often characterised that sector. Due to the spotlight, linking in with the spotlight around mental health services, really ensuring that there's increased capacity there. Yes, we can immediately think of CAMS, child and adolescent mental health services, and linked in with the NHS, but also thinking about other mental health supports and services that may be present within the community or connected to schools. And so we're seeing that more generally, but and wider than CAMS alone, but making sure there's sufficient capacity and increasing the investment around that. Continuing to build a trauma-informed workforce and not trauma-enhanced. Again, not just seeing that in the silo of perhaps social work or counsellor provision, but thinking about the whole workforce, from health visiting to education, right through to care and aftercare workers. And then in terms of 6, given that really tricky transitions and fragmented and fractured transitions for young people leaving care, really re-emphasising the importance of genuine, tailored through care and aftercare services for those children and young people, both into supported living, into employment, education, and independent living circumstances, but also if they are then progressing into adult services, making sure that there's that transition planning to those services. In the previous slide, I mentioned around recruitment and retention challenges. Again, we might just be on the cusp here. This could get more challenging through the burnout. So much of the workforce has given so much over the last 18 months that burnout might just be starting to trigger now, that whether it's bringing in attracting new staff or retaining staff. And then finally around making sure that in the schools and education that we're actually balancing priorities. So it's perhaps a bit outdated this, but in terms of not just purely focusing on attainment, but also considering around making sure there's sufficient attention paid to health and well-being. So just to finish, final steps, just so you have a bit of a heads up around what future work is planned, that based on some of the data questions that haven't fully been answered through the deeper dive that I presented today, there is some interest in doing a little bit more work around the under 5s and children and families in that age group, around what's been happening for them, trying to better understand who exactly is in that middle tier of the triangle, and what's been the response to that, and also that transition of young people into adult services. And linked, because this all stemmed from that weekly data collection, there is also planned work into revisiting that, whether particularly thinking about which indicators to retain, and whether new ones are added and indeed removed as well, where they haven't been working so well. So I'm going to stop sharing there, and sorry if I've overrun a bit, so apologies for that.